rests with the people who are charged with leading the city, and whether that's in the NHS or in local government. And the challenge for them is there's some radical work that needs to be done in terms of redesigning how we provide services so that we have a much stronger focus on that relationship with communities. And that's not a simple task, but that's actually what needs to happen.
The service, as far as I can see, has been effective in all areas. Getting people involved in their health and feeling better and more in control, whatever the condition, whether it's diabetes, heart disease, mental health, it's got enormous benefits. So I really see this service being effective right across the whole range of conditions.
I think we need a much bigger service, but we need services like primary care in particular that sees, just as it would say, well, health visitors are part of our service. So it would be saying, of course, it is natural that health trainers and health champions are also part of that.
We were entered into a competition called Transforming Community Services against 13 other teams in the Yorkshire and Humber region, and we won after our Dragon's Den-like presentation. And our idea was to have health trainers working alongside people with chronic pain. And the idea was to use their generic skills in helping people achieve their personal goals and motivation to work alongside chronic pain sufferers to help them manage their pain better. The main need for this initiative is that a lot of the chronic pain management currently goes on in secondary care services, which is actually quite expensive. People who have chronic pain, 1 in 7 of us suffer from chronic pain, and actually we need more of that support at a lower level and in primary care, which is where most of those people will be sitting. The key really is to make sure that we have this service evaluated. Okay, and that's why we've involved the university. So at the end of this 9-month period, we'll be able to say that health trainers either work or don't work for people with chronic pain. And if we do find it works, then we expect that there will be funding then that will come to fund so we can roll this out to the whole of Sheffield. And I think it can then be replicated nationally, and I think that's why we won the award, is because they see the potential of something that we could pilot locally but then develop nationally.
We've been really successful at gaining some short-term funding for a lot of this work, whether that's been lottery or 2 fantastic initiatives for diabetes and chronic pain, but they're short-term funding. So we've really got to make sure that the learning and the evaluation from those gets into the Commissioner's site and support so that we can make sure that we don't lose it and we develop it further. But I have got some hopes about doing this. So it sounds quite a challenge. We have, with the NHS changes, it really does say in the white paper about empowering local communities, engaging them in their own health. And if we don't do that, the NHS won't survive in this way because it costs too much. So really engaging people in decisions about their health and supporting them to do it, that's really important for the future. And the key thing is that the GPs recognise this, and the GPs are going to be much more in the driving seat with what gets invested in.